guard tower that the casualty was initially acting fine, but begins complaining of nausea, difficulty breathing, and abdominal pain, but now only reacts to pain. The casualty is laying on a litter, a long spine board, and there is another soldier available to assist. Standard: identify at least 6 signs of signals of shock with no incorrect answers within 1 minute. That is the beginning part. All right. So these are all of the signs and signals of shock. You need to identify at least 6 of them. And if you write down 6 and you get 1 wrong, you're a no-go. But if you write down 7 and you get 6 right, you're still a go at this lane. Everyone understand so far?
Whoa.
You have 1 minute to do this. If you're a slow rider, highly encourage you to practice riding quickly. And do not, if you're definitely a slow rider, probably do not choose the longest one to write down. The easiest ones to remember are definitely like the ones that say skin. Like sweaty but cool skin, blotchy blue skin, and the other one, pale skin. When you're writing these, all right, you do have to write them verbatimly out. If you like if you're like dyslexic, all right, and I like know what you mean, that's fine. But as long as I can make out what it is. If you're gonna write out the long ones, like restlessness or nervousness, you have to write them in that order: restlessness or nervousness. Right? And then the other one, nausea and or vomiting. You can write nausea and vomiting. You can write nausea and or vomiting, or nausea or vomiting. I don't care. I'll take it. All right, you have 1 minute to do so. Everybody tracking so far? All right, then part 2. All right, part 2. Apply cervical collar, treat for shock, and prepare for transfer to standard in sequence within 7 minutes without causing further injury to the casualty. Before you begin part 2, you're going to ask the grader, may I inspect my equipment and may I downgrade my equipment? Because if you do not ask to downgrade your equipment, you're going to do it with your weapon slung. All right, and with your gloves on and everything. All right, just downgrade your equipment and inspect your equipment. When you inspect your equipment, you should have 3 things in the CLS bag. Only 3 things. It's going to be cervical collar, the TCCC card, and the expo marker. And if there's a rag in there, cool, it is. You don't need it. Then you're going to check your straps. You're going to make sure you have all 5 straps. 3 straps are going to be along the spine board, and then 2 straps are going to be for the actual litter strap itself. That way you can see which ones are for which. Once you're ready, we're going to say 3, 2, 1, begin. All right. The grader is going to go ahead and say that the head and neck is immobilized because you have an notional assistant soldier keeping the head in line to stabilize you. So go ahead, do the beginning piece. All right, so.
Hey man, you're going to be okay. I'm going to apply seat collar.
You're going to reassure the casualty, and then you're going to tell them what you're going to do. You're going to apply seat collar. So you're going to measure 2 fingers, all right, from underneath the chin to the Adam's apple. All right, in this case, this soldier, we measured about 2 fingers, right, to the Adam's apple from the bottom of the chin. All right, can you show them how to measure it? My grader here is going to demonstrate how to measure and then how to utilize the seat collar and how to measure it. All right, come on, stand up so they can all see. I'll show them how it works.
First, going to pop out 2 nipples, then the 2 latches on the side. This will allow you to move the seat collar fully up and down. Then you're going to measure from this black line to this white plastic line over here. Put your index finger on the black line and you're going to adjust it until the plastic white line meets your middle finger. Once it meets your middle finger, you're going to then lock it in place, close the latches, and pull out the yoke. Do not forget to pull out the yoke.
What about measuring for women?
So for women, since they do not have a very prominent Adam's apple, you'll measure down from the ear to the chin, in which case mine will be 2 fingers, as you can see, and you use that.
Cool.
Then you apply the seat collar as such. Do not lift the casualty's head more than a single inch. Boom. Seat collar is attached.
So you do it while the ACH is on?
Yeah, the ACH is going to stay on. The next step, you're going to strap them to the spine board. There's no sequential order how you strap the casualty. You can start from the feet, the pelvis, or the chest, whatever one you want to start with. However, take note that the first strap across the chest must be underneath the arms. Secured high and tight underneath the armpits. If you do it over towards the abdomen, All right, he can't breathe, so you're further injuring the casualty. So make sure it's actually across his chest, his nipple line. The straps do not have to be like tucked in or whatever, but if you want it out of the way, just do it. All right, then next is the pelvis, followed by the leg straps. Another thing, you may straddle the casualty. However, if any of your equipment like falls off your flick or taps and it hits the casualty, you'll be a no-go. If you fall on the casualty, you'll be a no-go. If you put any pressure on the casualty, you'll also be a no-go. Moving forward, then you'll use the head block. You'll make the little M shape there. All right, you're gonna secure it, show them. All right, just gonna grab the sides and you're just gonna push it up. That way the head's immobilized. Then you're gonna grab the engineer tapes. One's gonna go across the chin, and it must go across the chin. It will not go across the throat. The other one's gonna go across either the forehead or the ACH itself. You do not have to tie it down, just laying it across. The next step, you're gonna assess for shock by using the acronym APU. Who does not know what APU is? All right, APU, A stands for alert, all right, and then B is verbal, so alert, verbal, P is pain, and then U is for unresponsive. So, hey, are you there? Hit an alert. So casualty does not respond. You can go check for P for pain. Casualty is not responsive but reacts to pain. And you're gonna check the skin. You only need to check one arm for this on this side, whatever side you're on. You don't see anything. Then you move to the abdomen. All right, there's gonna be a prompt. The writer's gonna state that the skin is pale and moist, abdomen is distended. From there, or you gotta treat for shock. Before you treat for shock, you gotta move him to a shaded area. First, you're going to secure him to the litter straps. Yeah, secure him to the litter, both straps across the chest, and then one at the legs. Now you're gonna stand at one end, and you're gonna say,
Moving the casualty to a shaded area.
all right, cool. Once you move to a shaded area, you're gonna unstrap him. Now you're gonna treat for shock after you unstrap him. Hold all questions to the end, please. And from there, you're gonna treat for shock. All right, demonstrator, go ahead and explain what you're doing.
So first you're gonna loosen the collar, undo the first button. You're gonna then move down to his arms. You're gonna undo his cuffs. If you have gloves on, you're gonna loosen the gloves, or if he has a strap on his gloves, you're gonna undo the Velcro. You do that for both arms. For his belt, you're gonna loosen his belt and undo it. For his legs, you'll untie his laces and pull on the tongue of each boot. After which you would then cover the casualty entirely with the blanket except for the face.
At this point, after you wrap him with a blanket, you're gonna secure him back to the litter and prepare him for evac. Once all straps have secured the patient, you're gonna reassure the casualty. Step on this side.
You're gonna be okay.
All right, then you're gonna say the next three things along the lines. You're gonna watch the casualty for life-threatening conditions. You're gonna say check for other injuries and seek the next level of medical aid. We have a little acronym that helps you. MSEEK, so MSC. So M, monitor the casualty for life-threatening conditions, seek the next level of medical aid, and check for other injuries. If you say watch casualty for life-threatening conditions, that's fine. If you say monitor the casualty for life-threatening conditions, we'll take that. But checking for injuries, you must state it verbatimly that way. And then seeking for next level of medical aid, you can say medical care, whatever. All right, as long as it's along those lines for those. All right, once you say reassure casualty and then say those three things, you can move on to the TCCC card. And I'll have my grader fill it out, and then we'll talk about it. Once you are done filling out the TCCC card, you're going to tuck it underneath the blanket, and then you're going to put the map marker back into the bag, and then stand up, say you're done. All right, I'll explain it here in a second once he's done writing. That's it. Okay, once it's tucked in, however, just tuck it, boom, stand up, say you're done. All right. So, for this TCCC card, on the front, you have page 1 of 2. How you know you're on the front page is if you have the little people on the diagram. Everyone see so far?
Mhm.
Maybe they're close. All right. Don't be fooled, but you have to fill out the category, the evac category up here. You're gonna mark the casualty as urgent. Scroll down in the conditions. What happened to the soldier? He fell. He fell from a guard tower. So you need to mark fall. Then on the category, right, so where you mark the mechanism of injury, like where the location is, you have the front person, like his face and eyes, and you have the back. You're gonna mark an X on his back where the number 18 is. Do not mark an X on the neck, you'll be a no-go. All right, you're gonna move down to AVPU, down at the bottom of the page. All right, when we assess for shock, what did the casualty respond to?
Pain.
Sorry, reacting to pain. You're gonna put a P there. Flip it over to the back side. Again, the casualty is gonna be urgent. You're gonna skip all of this. Underneath this block that says other, you have another word that says other, and it's big, and it has a semicolon beside it. You're gonna write C collar. So you apply to C collar there. Then underneath that, you have hypothermia prevention. You're gonna mark that, and you're gonna write blanket, because you wrap them up in a blanket, you treat for shock. In the notes, all right, you're gonna basically you're gonna write it down. You're gonna write signs and symptoms of shock. When you write down signs and symptoms of shock, you can write the word and out, or you can use the symbol for and. I don't care, but you're gonna write it all the way out. Then in the admin data section, you're gonna put your initials and then your last 4, or you can put 1, 2, 3, 4, I don't care. And then secure to the casualty. Does everyone understand so far?
Cool.
All right, any questions? All right, nothing at all?